Hello, today's topic is pathological calcification under the chapter Cell Injury. So, pathological calcification refers to abnormal tissue deposition of calcium along with other mineral salts such as iron, magnesium, etc. So, there are two types of pathological calcification. One is dystrophic calcification and the other is metastatic calcification. So this dystrophic calcification, it occurs in areas of necrosis, mainly in dead or degenerated tissue. There, the tissue levels of calcium, that is the body normal calcium level, is maintained. But in metastatic calcification, you see metastatic calcification in areas of normal tissue, but the calcium level in the body will be increased. So it occurs in areas of hypercalcemia, secondary to disturbances in calcium metabolism. So the main conditions, examples in which dystrophic calcification occurs, one is rheumatic heart disease in the damaged rheumatic valves. Apart from this, tuberculous lymph node, TB lymph node, in areas of caseous necrosis especially, and in atheromatous plaque, and psammoma bodies. Psammoma bodies are actually lamellated concentric structures, calcified structures, which are also example of dystrophic calcification. And metastatic calcification, as we said, it occurs in conditions in which there is derangement in the calcium level. So it includes primary hyperparathyroidism and Paget's disease, vitamin D intoxication, and Williams syndrome. Williams syndrome is actually idiopathic hypercalcemia of infancy. That is what is called as Williams syndrome. Apart from that, renal failure and milk alkali syndrome. These are various conditions in which metastatic calcification occurs. So this shows valves, heart valves, in which the macroscopically actually the calcification is always seen as chalky white gritty deposits. So this is a case of dystrophic calcification of the aortic valve. And microscopically, calcification is seen as amorphous basophilic granular substance. So this is an example of Monckeberg's medial arterial sclerosis. So Monckeberg's medial arterial, in the vessel as we know, there are three layers: tunica intima, media, and outermost adventitia. So in Monckeberg's arteriosclerosis, calcification occurs in the medial layer of the vessel. It especially occurs in old age. So this can be asked as a question. A thyroidectomy specimen and biopsy of the slide you have to diagnose. So this case shows tumor cells arranged in papillary pattern showing crowding of nuclei, and you can see lamellated concentric structures. So this is a case of papillary carcinoma thyroid with psammoma bodies being seen. So that is the diagnosis. So this can also be asked as a question. Here you will be asked a CNS lesion, a dura-based lesion. So you will be asked what is the diagnosis. So here you can see various tumor cells arranged in vague whorl pattern and in syncytial pattern with indistinct cell borders, and you can see various psammoma bodies. So this is a case of meningioma with psammoma bodies. So apart from meningioma and papillary carcinoma thyroid, other tumors in which psammoma bodies can be seen are mesothelioma, serous cystadenoma, ovary. So you have to remember, psammoma bodies are also example of dystrophic calcification. So the sites affected by metastatic calcification. Commonest site is lung alveoli. Apart from this, gastric mucosa and kidney tubules also may be affected by metastatic calcification. And special stains for calcium. Von-Cosa is the most important one. Von-Cosa stain. Apart from that, alizarin red. These are the special stains used for demonstrating calcium in tissue. So finally, a couple of questions. True about metastatic calcification. Serum calcium level is normal. We know that is false. Serum calcium level is always deranged. So, and occurs in dead or dying tissue. We know that the serum calcium level is deranged, but it occurs usually in the normal tissue, metastatic calcification, and occurs in damaged heart valve. That is also false, because we know that dystrophic calcification is what occurs in the damaged heart wall. So the only true statement is calcification starts in the mitochondria. So next, dystrophic calcification is seen in all except lymph node. We know that in TB lymph node, dystrophic calcification is seen, and in rheumatic valves also dystrophic calcification is seen, and in psammoma bodies also are an example of dystrophic calcification. So which is the condition in which dystrophic calcification is not seen? Lung. We said that the lung alveoli are the most common site of metastatic calcification. Next, again, metastatic calcification is not seen in, we know that kidney tubules, lung alveoli and fundal glands of stomach are all sites of metastatic calcification. But Monkeyberg arteriosclerosis, which occurs in the media of old individuals of the arteries, that is a classic example of dystrophic calcification. Thank you.